So this week, my journal entry is the first entry that I've done in this semester where the journal entry is not on a pediatric patient. The patient is actually a 20-year-old female, but I felt like it was appropriate because it did make a pretty significant impression on me. I thought it was interesting in that the fact that as the patient came in for an intake, we were with the patient for a full hour, and she was going through the interview process. And one of the things that she first mentioned is that she kind of has like an extreme fear of abandonment, and then just went through some classic symptomology of the 9 criteria that are discussed in the DSM as far as borderline personality disorder diagnostic criteria goes. And as she went through, she was just describing how she's been in and out of various inpatient treatment facilities, and how she has been in and out of PHP, IOP, and a lot of broken relationships with people, but kind of a lot of things that her parents have maybe fed, and that she's just not really making it through life effectively. And I'm not really sure that, and I know that she hasn't received this diagnosis before, and it's something that she was very adamant about, is she doesn't like people messing with her diagnosis. However, she's been on innumerable amounts of medication, and nothing has ever seemed to work. She does have a history of self-harm, suicidal ideation. Again, like I said, all of the classic borderline personality diagnostic criteria. And I thought it was interesting because as I was sitting there thinking this, and just very early on in the interview, all the signs were there. And typically it's not a good idea to give a patient this diagnosis early on in the relationship. And I understand that. I realize that. But the clinician that I work with, the preceptor, I refreshed my page and noticed that in the charting system that she uses, that she had actually rule out borderline personality disorder. So obviously we were thinking on very, very much the same pathway. So it was interesting for me in that I have seen this in clinicals before, but it's already been diagnosed, and people are actively receiving treatment, usually dialectical behavior therapy or various treatment modalities. But I've never had it in a patient where it's been undiagnosed and so clearly that was most likely what the issue is. However, I do know that you have to be careful with that diagnosis, and you have to see it through. And it is probably important that she does continue to see her before she confirms the diagnosis. But I felt like it was worth a journal entry, and I did want to mention it as my final journal entry because it was so, it stood out to me so clearly from the beginning of the intake throughout the end. Thank you.